Hi, it's Dr. Noel Williams, January 3rd, 2021. New year, we can be excited. Lots of good things are going to happen in 21. So, so let's talk about COVID update stuff. I haven't done a little talk in a bit. I've been really actually pretty busy with work and then needed to take a little break this weekend. But even during the weekend, I mean, we had lots of new COVID starts for outpatient therapy. I think Thursday and Wednesday combined, we did well over 40 treatment uh, initiations on COVID patients at various levels of illness. And I did a few each day all weekend. So lots and lots of COVID, the most COVID we've treated. Definitely over the last 2 weeks. And that's kind of what the numbers are showing. There were 8,000 cases in the last 2 days in Oklahoma. We have more than 3,000 deaths. So the system's, again, being taxed. And you just got to keep in mind that if the system hadn't been taxed already, its ability to adjust to this would be better. But it's already been kind of worn down. So people are tired and who are taking care of these COVID patients and working in hospitals. So again, really need to say thank you to the nurses, need to say thank you to the doctors, support staff who are doing this. Likewise, I mean, another group of unsung heroes are these pharmacists who are bending over backwards to help all of our patients these last 6 to 12 months. Big shout out to Thrifty Pharmacy and Danny. We couldn't have done the last 2 or 3 weeks without her. And then again, CVS and Walmart and Walgreens and all the other Ralph's pharmacy. Again, all these pharmacies have really tried for their patients. 1, to get the Ivermectin, 2, to get the steroids in, 3, to get the antibiotics in and be available for their patients. So I think if you see your pharmacist next to, say thank you, because they're working really hard and I think they don't get the credit they deserve. But we've been working a lot with Danny Lynch, so because she's just overachieved, amazing at Thrifty, and they're great, and we can't thank her enough for helping all of our patients. And her staff has been fantastic. So anyway, a lot of thank yous. So COVID's here. We're going to have a long 2 months, and then hopefully we'll start turning the corner. Let's talk about the vaccination availability. So the first came the Pfizer, now the Moderna. Both are very good vaccines. I mean, I've had an adjustment over time on them in reading more and more literature. I think they're not perfectly safe because we don't know if anything's perfectly safe, but we can be pretty certain that they're reasonably safe. And we know that this about both of them. Once you get your first vaccine, 10 days later, you have an 85% chance of being immune to COVID. And if you do the second vaccine like you're supposed to on around day 21, you're going to hit 95% a week later. So that's a pretty good response, and that's in a double-blinded trial. The antibodies go up. Really good news there. The challenge is getting the vaccines out. And this is one of the things I've learned from our task force is the way the vaccine comes in. So this is what people need to know if you want to get the vaccine. First and foremost, if you live in Oklahoma County, you call the Oklahoma County Health Department. They are actually going to be in charge of getting the vaccine out to the public. So you need to call them and call them now. How are they doing it? They're not announcing it that much, and they may be, and I'm just missing it, but all of us are kind of missing it. So they need to they got to get on the stick and let people know how they're going to do it. And the thing to keep in mind, some of the counties in Oklahoma, for the big cities, and we're going to talk about Oklahoma County, the state health department does not directly oversee them. There's a firewall between them. So Oklahoma State Health Department has the vaccine. They give it to Oklahoma County Health Department, then Oklahoma County Health Department has to administer it. And there's some very, very separate structures within those entities, and the Oklahoma County Health Department doesn't necessarily want, or not that they're against, but they're not part of the Oklahoma State Health Department, nor do they want to be. And so the Oklahoma State Health Department can help guide the Oklahoma County Health Department on how to do the vaccine, but it's the Oklahoma County Health Department. And so that's why some of this, if you've been following the news, Fauci said maybe the federal government needs to take over this. I don't know how they're going to, but maybe they should have thought about that before Dr. Fauci. But then again, there's a lot of things that I think he could have thought a little bit about besides just being on TV all the time and not doing his job. Because if you're on TV all the time, you're not doing your job. I mean, So whatever. So, but the bottom line is, if you're in any county health department is going to be involved with the dissemination of the vaccine, so call your local county health department. The ones that are in smaller counties are very closely aligned with the state. The ones in some of the larger metropolitan counties are more collateral to the state. So just call and find out how they're going to do it, and you'll probably end up, for some of you, will need notes to get the vaccine earlier. And I would definitely encourage you to get it. There's still people who think the vaccine isn't a great idea, and that's fine, but I just want to be clear, there's no data showing there's little micro machines inside the vaccination that's going to follow you around and tell the government about you. There's no data showing infertility or harm. It's a messenger RNA vaccine. It can't go retrograde into the cells and turn the cells into something else. I mean, there may be some ramifications for a messenger RNA vaccine, but that isn't one of them. So at this point, if you want to get to normalcy, I would encourage you to get the vaccination. The other part is, eventually the harder way to get the vaccination is to get COVID. And since we have a bunch of sick people right now, most of which are doing well, but a few who are not doing very well, I would really strongly encourage everyone to get the vaccine. I've gotten the vaccine. I'm still here. I'll get my second dose at the end of this week, and then I have a 95% chance of immunity, which I'm kind of excited about, to be honest, because life becomes normal then. You don't have to be as paranoid all the time. I mean, sure, I'm still going to wear my mask and do all the right things because I want to be a good member of society. But ultimately, the point of this is, once enough of us are vaccinated, these societal restrictions should go away. If they don't, then we have to, I don't know what we're going to do, but we're going to have to do something, because once a certain number of us are vaccinated or infected, there's herd immunity. Fauci changed it to 90% randomly a week or two ago. It's still 70 to 75%. And again, the new strain is inactivated by the antibodies that people already have. Otherwise, there'd be a whole bunch of reinfections in England. So, and once again, the data is now coming out that it wasn't effective. The vaccine still covers it. So all this mutational stuff is, remember, the virus mutates every third to fourth transmission. Most of them are not super important. The one in England was more important because it makes it more infectious. It is not more infectious to children. It's more infectious to everyone. The reactionary media comments are always wrong. It is just a slightly more infectious virus. So it can spread more and more people can get sick. It's not more intense, but as the volume of sickness goes up, the ability to manage the acutely ill becomes harder. So Kim, what questions do you have?
Okay. What are your thoughts on the AstraZeneca vaccine?
The AstraZeneca vaccine, or the Oxford AstraZeneca vaccine, did not follow the protocols that they all agreed to beforehand, and they made this pledge that we won't combine data and we won't do this, we won't do that. We're going to make this the best studies we ever did. Well, Moderna followed it, and Pfizer did. AstraZeneca did not. They've combined data. I don't think, and so one, that makes it out for me. They had all kinds of logistical problems in their study and some flaws in mechanistically in how they did it. So I would never use the AstraZeneca vaccine. That's me. On the other hand, AstraZeneca does have a antibody that they have developed that's in phase 3 trials that looks amazing. So, they may have blown it on one thing, but they have an antibody that's going to be, looks pretty phenomenal for those who get infected with COVID. So that's exciting. So, but I wouldn't do the AstraZeneca vaccine, but it's not approved in the US, and I'll be surprised if it gets approved in the US.
Okay. Will your office do vaccines?
The long and the short on will we do vaccines is no. We were looking at it. It is so intimidating to actually start on the application, which I started on. There's an initial application that's about 30 minutes, and then there's another 4-hour one after that. And there are so many reporting requirements with huge fines that it actually becomes fairly impossible for a private practice, even one like mine, to adopt to that level of paperwork oversight and logistics. It's just not something, this has to be, I think, administered more through the hospital system or a health department for the most part. I'm sure there will be some practices who can do it, but we do not think we're going to be able to.
Do you know, are healthcare workers taking ivermectin as prophylactics?
I'm sure some healthcare workers are taking ivermectin as prophylaxis. Yes, I'm sure there are. I mean, there are lots of people who do.
What are your current thoughts on hydroxychloroquine?
I think hydroxychloroquine is a really good alternative to ivermectin. We've switched to ivermectin first. If I couldn't get any ivermectin for several days on a new person with an infection, I would put them back on Plaquenil like we had been doing.
Have any of your patients that are on Plaquenil on a regular basis, not for COVID, contracted COVID?
Maybe one so far in 10 months. I think I had one person get mildly infected out of hundreds and hundreds on Plaquenil.
And then on your last video,
And I will want to comment, I probably don't know everyone in the practice who's had COVID, but the people who've been on Plaquenil, when we see them, we ask, and none of them, I think we've maybe had one, but I'm not even sure if we've had one.
Okay. And you talked about ground glass in the lungs.
Mm-hmm.
Does that resolve itself, or what is the treatment for that?
So ground glass in the lungs, where there's nodularity in the lungs, which are bundles of little nodules of inflammatory cells with dead lung cells, we're not sure what the clinical course will be. It appears that some people it does resolve, some people it may not. We don't know yet.
Okay. What's up?
Okay, well, so bottom line, wear your masks, take your supplements. The supplements are going to be the number one thing. If you get sick, they're going to make your immune system fight this off. It will help if you do get ivermectin, it will make the ivermectin work better. If you don't get ivermectin, it's your first line therapy. So I would strongly encourage you to do that. That's what I do every day. That's what Kim does every day. That's what we try to get all our patients to do. So, and we've had great stories of people getting COVID and they're on their supplements and they haven't noticed. And we've had hundreds of those now. So that's what I would always recommend, and get the vaccine when you can get the vaccine. And I'll update people as to the process in Oklahoma County once Oklahoma County Health Department has an idea what they're going to do. And some of that is they don't know when they're going to get it, but some of that has to do with interacting with the right entities. But I can tell you the state health department's really motivated to get vaccine to every county that's interested. So that's the summary. Good night.